Welcome back. Well, a modern IT system is helping maximise the number of patients and their families that Ronald McDonald House can accommodate at any given time. But the use of data to assist this process was not something the charity had anticipated when building out in South East Queensland. Well, Christopher Macaulay, CEO of Ronald McDonald House in South East Queensland, joins the program now from our Brisbane studio. Chris, appreciate your time today. Look, just to start with, why was this IT system so important to this rebuild, this project?
Well, it's a very big rebuild and a very big project for us because it's a 13-story, 70-room building in South Brisbane that needs to connect to all our other facilities, as well as being able to have the families connect to their families while they're staying at a very critical time with their sick children. So it's really important from both a family perspective, but also from an operational perspective.
On the family perspective, what does it mean for the families and I suppose the ability to accommodate the families?
Well, it's very important because it's really like a mini hotel that we're running, but it's more than a hotel. So we've got to be able to check people in and facilitate that side of the business. But also the families who are there are not there for a holiday. They're there during a really critical time with their very seriously ill children in the hospital. So they need to be able to access both the staff in the hospital, connect with their children in the hospital, and also a lot of their family and their support networks are back in the rural and remote areas of Queensland or even into New South Wales. So they're very disconnected unless we are able to bring them together, and this is where the technology plays such an important role.
And were you surprised by the level of need or how much of the actual tech you needed when undertaking this project?
Well, we did quite a considerable amount of planning for this building because it's quite a significant building for us, particularly for a not-for-profit.
Yeah.
$35 million build is pretty significant.
Wow.
So we did quite a lot of planning. We did consider the infrastructure, but I think we also didn't completely understand the complexities because it's really not our business, but we had connections with Dimension Data who came on board late in the build, but they really showed us not only that the work we had anticipated, but how we could build on that and the extra work that we needed. So this building is really about building for the future. So we needed to put in the infrastructure both for the current need but also going forward, as does any business.
Yeah, and going forward, you mentioned how there are obviously benefits operationally. What do you see as being the key ones as you look to the future?
Well, when we moved to the building, we tried to fit out the entire building, but unfortunately we couldn't quite complete all floors. So we shelled 3 floors, so it means that we've now got these 3 floors to grow into. So unfortunately the capacity of the building was at opening about 90% full, and it stayed around those levels for the rest of the time since we've been opened last November. So we're looking to grow into those floors pretty quickly, and I think the advantage of the work that Dimension Data did for us and their partners was to give us the infrastructure so that we could actually grow and expand into those extra floors, as well as being able to stay connected with our other facilities. I think we also run this is a 70-room house at the moment. We also run a 50-room house on the other side of the river in Brisbane at Hurston. We have 10 rooms inside the Lady Salento Hospital, as well as family rooms on the Gold Coast. So we're pretty well spread out, and we really do rely heavily on the infrastructure.
Well, it sounds like an absolutely wonderful upgrade to the project. Appreciate your time today. Christopher Macaulay, thank you.
Thank you.